If I don't talk about it,
You don't need to know.
uh-huh, exactly, okay? I will emphasize the things I think are most important. So, let's do this, shall we? Oh, and I tend to put the most important things on quizzes too. And I'll be putting up a quiz on this that you need to complete prior to the lab exam. All right? Complete it prior to the lab exam. Nothing irritates me more than getting a message after a test and being like, oh, Mr. Hopper, I didn't get that quiz done. Can I do it now? I'm like, well, it's not going to help you. The objective of the quiz is to help you do better on your test. Let's do this. All right. Oh yeah, real bones. Don't mess with the bones. There's real bones in here. You know, treat them with respect. And further, if I see you writing on bones, man, don't do that. Okay, don't write on the bones. Don't use your pen to point at stuff. Like, don't do it. Okay. Like, I'm talking about the plastic ones.
Oh, okay.
Like, I can grab up these skulls. This skull that probably costs $300 or $400, and I guarantee you, like in the ear hole, some genius has rubbed their pencil around. I touched it with the. Ooh. Don't do it. Don't do it. I believe we've already had this conversation. A foramen. A foramen. That's a tube or an opening, okay, going through a bone. You'll also hear the term meatus. All right, meatus gets thrown around a lot. A fossa. A fossa is an indentation. We've had this conversation, haven't we?
I don't, none of this sounds familiar. No.
Okay, let's have this conversation. I am going to grab your lab manual, and I'm going to turn to page 36. Page 36. Have I established to you that sometimes your book, your lab manual doesn't quite give you as much information as you probably can have?
Yes.
Okay? For you to learn what an external acoustic meatus is, you gotta have an idea of what a meatus is. Okay? Like if you need to hear about a patellar surface, if you need to hear about an acoustic meatus, like knowing the terms is gonna help us as we progress. So let's get the terms out of the way, and then we'll talk about the parts of the bones. All right, away we go. Foramina, an opening or an orifice. Okay? Like you have optical foramen. The optic foramina, I'm going to have to get a pointer. How this is going to have to work. Give me a second, team. Gross, unclean tools back there. A really nice example of this is the optic foramen. Can you see it right here? That's where your optic nerve would go through. Right? That's where your optic nerve would go through. That's an optic foramen. A foramen is an opening or an orifice. And again, you'll also hear the term meatus used for this. Like you have an external acoustic meatus where your ear connects. Right? So these terms are important. They're like tubes. Okay? Tubes that travel through the bone. You can see that right there. You also hear the term canal. Do I have canal here? Yeah, tubular passage or channel. Yeah, absolutely. Normally, when you hear canal or meatus, you think of something larger, whereas a foramen would be something small. Okay, a small opening would normally be a foramen. Like if I had a skull with a jawbone. Here we go. So your jaw is considered the mentis. Okay, mentis. It's the mandible, but mentis is a very important term. That is a mental foramen. See, it's a small opening. Okay, so that's how this works. Okay, foramen, foramina, canals, meati, they're openings. Stay. Stay. All right. Yeah, that'll do. Fossas, little indentations. A fossa. Like the bottom of the skull has a mandibular fossa. That's where another bone would connect to it. So a fossa is a little indentation where other bones would connect in most cases. A little fossa, like a mandibular fossa right there. Okay? That's the area where the mandible would connect. See it plain as day. And you'll note that I've got a tool from back there, a pointer, so I can show you what I'm talking about, not right all over the bone. fissures or deep cracks and openings, which we probably won't talk much about, but there are orbital fissures, big cracks like this. It's an orbital fissure. Okay, big openings like that, orbital fissures, big cracks in bone. Sutures are areas where two bones grow together. Look in the skull here. These are nice sutures where those bones grow together in that fashion. Okay, sutures. Sinuses are cavities within the bone. So this is what you got to consider, all right? When I turn sideways here, you got to imagine my spine kind of connects right between my fingers. You guys with me on this?
Mm-hmm.
So there's a lot of this out here, but not much back there. Truth?
Mm-hmm.
Or my wife would say not much up here, but something. Anyway, moving on. The idea is that most of this is hollow, all right? Like my mouth's hollow, my nasal cavity's hollow. And all these bony structures up here, okay, they've all got sinuses in them, open cavities. And you know this because you've had sinus pressure or sinus issues. It's this up here, yes? So all this is hollow to deal with the weight balance from where your skull connects to your spinal cord. That's kind of cool. And then, of course, there's lines and crests and tuberosities and processes and you name it. These are all going to be areas where the bone is kind of bumped up or has undulations in the surface. This is going to be places where muscles or ligaments or tendons connect. Remember Wolff's Law? We established today that the tendons will pull up against the bone and cause it to form nodules where the bone will connect to the tendon. Yes?
Yes.
Those are lines, crests, tuberosities, processes, what have you. So with that in mind, let's proceed. Everything here is fair game, mind you. I don't expect to ask a whole bunch of bones on the test. I'm more concerned with the parts of the bones. I think this is amateur hour high school, okay? The parts of the bone is where the rubber meets the road here. Let's go straight to here. All right, now 36 and 37 should not worry you too much. 38, 39, a little bit of 41, 40. That shouldn't stress you out too much because last week I asked you to learn all the bones, did I not? Good, so you should be at least familiar with that. See how I'm hard timing you guys a little bit? Do what I ask and you're gonna do way better in here. I see a lot of you looking very nervous. Part 2 of this conversation is that 36, 37, 38, 39, 40. There's really only about 15 things there, maybe 20. What you're looking at is repetitive labeling, all right? Like if you look at my slides up here, you can see the sphenoid bone right there. That's the sphenoid bone, there's the sphenoid bone over there. If I go to here, there's the sphenoid bone again. If I go to there, here's the sphenoid bone on the bottom. If I go to here, here's the sphenoid bone from the top. If I go to there, there's the sphenoid bone from the inside. You guys get my point? It's repetitive labeling. It's not as bad as it looks. All right? It's bad. I'm not shortchanging it. It's bad, but it's not unmanageable. The reality is this is not that complicated, especially if you know the names of the bones. So let's run through a few things and talk about it, shall we? All right. I invite you to use your lab manuals. Everything's in there that I'm going to talk about. If it's not, we'll fix it. All right, so away we go. I believe I already mentioned orbital fissures, did I not?
Mm-hmm.
There are orbital fissures. These are big cracks in the eye sockets. So I'm just giving you an idea of what these things look like. Big fissures, big cracks inside of there. They exist. I don't even think they label them in your lab manual, do they?
They do not.
They do not. Like, I'm just throwing it out there that they exist. I don't expect to throw that on your test. I'm just giving you an idea of what you're looking at here. However, the optic canal, which I've already mentioned, guaranteed you're going to be seeing that again. All right? Let me tell you what's happening here. Optic canal. And you can see that plain as day on page 36, right-hand side, 4 down from the right. The optic canal is going to be where your optic nerve passes from your eyeball towards the back of your brain. So your eyeball is out front, and the optic nerve comes off the eyeball and travels through the optic canal to go inside the skull. So you can see this. Now, what did I do? There it is. You can see this here. That is where your optic nerve comes into the skull, right there. So it would come in and connect to a structure kind of sitting where my finger would sit, called your optic chiasma, right? So there it is, right there. That's where the optic nerve would come in. That is a optic canal, as it were. You kind of see one on that side, one on the other, right? So this is where the optic nerves would come in, where they can join and become part of a single unit referred to as the optic chiasma. That's what we're dealing with here. All right, as we move down, you can see the ethmoid bone labeled here. Like, there's so many parts of the ethmoid bone on the inside of the skull here. It's outlandish. I'm not going to talk too much about the inside of the nose. What I will point out, however, and you can see these on page 36. Do you see nasal conchae, like 5 down? Yes?
Yeah.
If I were you, I'd be familiar with the nasal conchae. The nasal conchae are these little projections that are sticking out. There are 3 of these. I just want you to call them nasal conchae. Look inside the nose there, folks. Right there. Okay? Look inside the nose. Can you see these things turning? Like these little twisty things?
Yeah.
All right? Little twisty things inside the nose. Look, there's one right there. Right? Little twisty bits. See it right inside of there. That is one of the turbinates, commonly referred to as the nasal concha. Now, C-O-C-H, anytime you ever see that, that's shell-shaped. Okay, shell-shaped. Like a conch shell from the beach, you guys know what I'm talking about?
Mm-hmm.
Shell-shaped. So it's supposed to be a twisty-looking, shell-shaped thing. And the reason that this is there, and this is super important, team, the reason you have nasal conchae is because when you're breathing in through your nose, they help to spin the air and make it turbulent. And that helps you warm air up. Your lungs like warm air. Moisturize the air. It adds humidity. Your lungs like humid air. And it's covered in mucus, which means it cleans the air. Your lungs like clean air. Your lungs like clean, humid, warm air. And the turbinates help make that take place. So be able to tell me that the ethmoid bone includes these nasal conchae. It's important. What's next? Mental foramen, already labeled that one. Oh, we need to talk about this. All right, let me make a point to you. Do you see on this first image, page 36, do you see the, it's got ethmoid bone, lacrimal bone, all this fun stuff labeled? Yes? Can you tell what the heck it's looking at? I can't.
Kind of?
This view is not conducive to understanding those bones. So what we do is we use a better view, like on page 37. Now, look at the right-hand side of page 37. Like 5 down, you see nasal bone, then you got the maxilla, then you got the lacrimal bone, then behind that you got the ethmoid bone. All right, look at this, team. With this view, I can see the nasal bone, the maxilla, the lacrimal bone, and the ethmoid bone in line with one another. That helps me to get a grasp of what I'm dealing with. Now, nasal bone makes perfect sense. This is part of your nose, nasal. The maxilla here is the top jaw with the mandible being the bottom jaw. Then behind that, you've got this lacrimal bone with its lacrimal fossa. Now, as I've told you before, it's a lot easier to learn these parts and pieces if you understand what they mean. And anything lacrimal deals with what? Anybody ever heard of your lacrimal apparatus? What is it? Looking. Tears. The lacrimal apparatus is your tear production center. Okay? It makes tears. Very important for getting your point across when you're upset and keeping your eye clean on a moment-to-moment basis. Apparatus. But in particular here, we're just focusing on the bone. Okay, you got a lacrimal fossa and a lacrimal bone. Let me show it to you. All right? So what you'll do when you make tears is the tears are produced sort of on the outer margin of your eye. They wash across the eye into like the middle here, which is why when you got stuff in your eyes, you blink, it kind of cruises the middle. Yes? Like every now and then again, you're like, oh man, what is that? Okay? That's why, because stuff gets pushed to the middle by your nose, where it goes into a lacrimal sac to drain down your throat and into your stomach. This is how this works. And if you look, you see the hole right there? Okay? You see it? So that's the lacrimal bone with this little lacrimal fossa. Okay? It sounds like I'm talking about the dad in the Lion King. Lacrimal fossa. That's what it is. Okay? You can see it plain as day. See the hole? It will go all the way down to the nasal cavity and down the back of the throat. So when you have a stopped up nose, sometimes you might have noticed that like you'll yawn or something, have a bunch of fluid, and it'll run straight out the front of your nose. Yes?
Mm-hmm.
What's happening there is it's not being able to go the regular route because of all that mucus in there. It just runs out your nose. That's why you get a runny nose whenever you've got a cold, because your mucus membranes clog all this up. It just causes ulcers. That is a lacrimal fossa, a lacrimal foramen base. Yeah. So parts of the lacrimal bone, worthy of our knowledge. Oh, look here. There's the zygomatic bone, with the zygomatic process, and the temporal bone beside it. Oh, this is a tricky one, team. Pay attention. Look at page 37. What you see is this zygomatic process. The zygomatic process is a fancy way we refer to your cheekbones. You can feel them, okay? Those are your zygomatic processes right there. The zygomatic process is something that sticks out, okay? The zygomatic process is part of two bones. Part of the zygomatic bone and the temporal bone. You see it? Look. All of this is zygomatic process. All of it. That's the zygomatic bone. That is the temporal bone. So what I might do on your test is get kind of irritating. And put a star back here. You'll see the suture. Put a star back here. And say, what is this process? Question 2, what bone is it part of? And half the folks put zygomatic bone. Don't do it. I'm telling you now. Pay attention. Watch for this. Depending upon where the star is, will tell you if I'm asking the zygomatic bone or the temporal bone. They are separate from one another. Okay? All part of the same process, two separate structures. All right, what else we got here? So I've already talked about the external acoustic meatus. This is the opening for the ear. Let's talk about the mastoid process and the styloid process. Styloid. The styloid process is supposed to look like something you write with. What's that thing you write on a tablet with called?
Stylus.
A stylus. Styloid process. In particular, this is not referencing your tablet. This is referencing a quill pen from back in the day. But you get my point. Okay? The styloid process is very pointy. All right? A nice, pointy styloid process right there. It's kind of hard to tell where it sits based off of a 2D image. It sits in deep. All right? It's deep to the mastoid process on the outside. Your mastoid process is easy. The mastoid process is simple. You can feel it. Right behind your ear, that lump right there, that's your mastoid process. It's what your sternocleidomastoid muscle connects to. So if you were to kind of turn your head down and away like this, you feel that muscle right there? That's your sternocleidomastoid. And if you follow it up, it'll terminate at the mastoid process right there behind your ear. That's what this is. Why is this all stuck out like this? Because what's your mastoid or sternocleidomastoid muscle always do? Yanking on this thing. Okay, so it makes it very tough and strong because, what's that called? Whose law?
Wolf's Law.
That's it. Okay? Holistic anatomy class. We're putting all this together, Jeff. All right, good. So that's the styloid process and the mastoid process. We already talked about the zygomatic bone, temporal bone, coronal suture. Good. All right. The sun has a corona. So when you look at the sun, it's got this blazing fireball around it. That's the corona. Your coronal suture is right there. Okay? Just like this. Just like that. On this skull, the coronal suture is where the frontal bone connects to the two parietals. Nice coronal suture. That's what we're dealing with here. Nice coronal suture. All right. Let's go here. Yep. Okay. Let's just start out with the foramen magnum and the occipital condyles on page 38. Foramen magnum, lower right-hand side, and occipital condyles just above it. The foramen magnum, okay, let's make sure we understand our terms. What's a foramen? An opening in bone, yes?
Yes.
And then magnus means large. So it's a large opening. Foramen magnum. All of this through here. It's the biggest opening in the skull. It's where your vertebral column would connect and where your spinal cord would pass through. So it's a big, huge opening, the foramen magnum, okay, magnus. And on either side of that are these two little bumps here. These are called the occipital condyles. A condyle is a rounded projection that sticks off a bone. Do they look rounded to you? The occipital condyles articulate with the top of the spinal column. So your vertebrae have cups. Would I ever lean this over so you can see it? Let's see. It may hit the ground, I don't know. Can you see the cups there?
Yes.
So this would sit with those round spots. Oh, smooth! It's like I've done this once or twice. All right, so these condyles would lay in those cups so that you can kind of move your head around and do the things that you do. This is part of it. So condyloid joints are kind of famous for their movement. It's going to play a role there. So those are occipital condyles. These are the areas where you connect to the spinal cord. And as you would expect on the base of the skull, there's a bunch of openings where lots of things go in and out from the skull. Lots of nerves pass in and out of the skull, not just through the foramen magnum, but through other areas as well. Lots of arteries, lots of veins. There's a lot happening here. So we need to talk about some of the major ones. I'm going to keep this real surface level. We're going to talk about the carotid canals and the jugular foramen. For me, I do jugulars first. Easy. Jugulars are simple. If you know where the jugulars are, you can spot the carotids a mile away. Okay? So let's do the jugulars, shall we? Now, let's make sure we're clear. Jugular versus carotid, what are they? Jugular is a vein. Carotids are
Arteries.
Good. So arteries are small, veins are big. So if you look at the skull and you kind of hold it out reverse Shakespearean, Mr. Scramstead, kind of hold it out like so, the jugular opening looks like an old school Valentine's Day heart. Can you see it? Right? Plain as day. Old school Valentine's Day style heart. That is what the jugular opening looks like. And by the way, on your test, I'll have this stuff laid out there, man. You can pick it up, manipulate it, do whatever the heck you want. Okay? That right there, the old school Valentine's Day heart. That is a jugular opening.
Like a jelly bean.
Like a who?
Jelly bean.
On
Yeah,
that
sound-
picture.
yeah.
This is what they really look like. All right? Nice Valentine's Day heart. That is a jugular foramen. Jugular opening. See it nice and clear right there. Okay? Jugulars. Right. And if you know where the jugular is, kind of flip this thing over. Okay, the opening right in front of it. It looks like a hole within a hole. Those are carotids. All right. So the carotids are going to be right in front of it. They look like a big hole with a little hole inside. That's a carotid. The jugular back there, that's the carotid. There's a carotid. Right there. So right in front of where the jugulars come out. So the carotid arteries, jugular veins, they're going to be close together with one another. So if that's the jugular, through there, carotid is right there. Okay, hole within a hole. And that's what they look like. And you will not see jugulars inside the skull. Because the jugular, no, lies. You will not see carotid arteries inside the skull. Because what the carotid does is it comes up and terminates into this carotid canal there, and then it branches through the bone. Okay, it doesn't stay inside the core of the skull. Branches through the bone. Yeah, you can see that right there. All right, good. That's how this works. Where am I at? There's something else. Oh, it's on the inside of the skull. Never mind. Yeah, that'll do. That'll do. Let's go here. Speaking of the inside of the skull. Oh, man. You need to be best friends with the cribriform plates and the cristagalli. Best friends. You need to make best friends with the cribriform plates and the cristagalli. All right, let me explain how this works. The cribriform plates are flat plates with holes in them. These holes are called the cribriform foramina, but what I would call them is the olfactory foramina. Okay, they are all olfactory foramina. It's got little holes. So if you look at this thing, you can see the like undulations in shape. There's tiny openings in reality all through this. The cribriform plates have little holes all in them. Okay, kind of hard to see on this particular skull, but they're there. They exist. look for the cribriform plates that have little holes in them. And those are the olfactory foramina. Now, between the two cribriform plates is a structure called the cristogalli. And in these plastic skulls, it does not do it justice. In a real skull, the cristogalli sticks up like a spike. Okay, it's tall and lengthy. And what this does is fascinating. You see, the front of your brain is symmetrical. And you have these two structures called the olfactory bulbs. And what the olfactory bulbs do is they lay on the cribriform plates. They are separated by the cristogalli. Two little bulbs laying on the cribriform plates. And they have little dendrites that hang down into the nasal cavity that allow you to perceive smells. All right? This is the shortest distance between the outside world and your brain. So the olfactory foramina have openings that allow the brain to sort of interact with the outside world to detect smells, odors in the outside world, to detect chemicals. This is chemoreception in the grand scheme. So the ethmoid bone is very important for this. Cristogalli, cribriform plates, they're very important. Next, I'll mention the internal acoustic meatus. All right, look at this, folks. Everybody look up here. External acoustic meatus on the outside. This is where sound waves come in to the ear. Internal acoustic meatus on the inside. This is where a nerve goes to your brain. Your hearing apparatus is between my fingers right there. Your whole hearing apparatus is that lump that I've got a hold of right there. Coming out of this, that's where the nerve is that goes to your brain. It's called the vestibulocochlear nerve. You ain't got to know that yet, but soon. Okay? So there is a nerve that comes out of that internal acoustic meatus. The external is on the outside of the skull. Move that over here. Yeah. There's the internal acoustic meatus right there. All of your hearing apparatus is between my fingers. So your inner ear, middle ear, it's all right inside that. All right, what's next? So jugular we've already done, internal we've done, optic canals we've done, cribriform plates we've done, frontal bones you should know. All right, selaturcica. So if I were you, I would be friends with the selaturcica. This is part of the sphenoid bone, okay? The selaturcica is the area where I've got my little finger, right there. See how my little finger almost fits in the gap? Yes?
Yes.
The selaturcica, which stands for Turkish saddle, supposed to look like a saddle, like you could ride on something. So it's not talking about like a saddle. Okay? The selaturcica is kind of like the little cage your pituitary gland sits in. It's roughly the size of my little finger. Okay? So it sits inside of the selaturcica and is held in place underneath what's called your optic chiasma, which we talked about earlier. So you've got to imagine, you got to imagine that the selaturcica is there, with the pituitary gland sitting inside of it, and then the optic chiasma, which looks like this, sticks into the optic canals there and there, with the pituitary gland hanging underneath it. That's how your brain is structured internally. Learning these parts is going to help you understand brain structure as we progress. Let's keep that in mind as we go. And then, last but not least, so I'm mainly showing you this for two simple reasons. I want you to understand that you've got these conchi inside of your nose that help you warm air up and humidify it, etc., etc. And I want you to understand that the bones in your skull have openings called sinuses. You got a sphenoid sinus here, frontal sinus here, ethmoid sinuses out here. You need to be able to tell me on your exam that your frontal skull bones have sinuses that make it lighter. Yeah, absolutely. All right, good. Page 41, do I have a baby skull on here? I don't. What? What an interesting question.
Yeah.
I can tell you some stories. All right, we need to talk very briefly about the fetal skull. This is on page 41. Page 41 of your lab manual. I've somehow managed not to put it in your lecture, but I'll show you. It's a nice plastic baby skull. It may be in a later I don't know. I honestly forget. Nice plastic baby skull. I know where this is going to be when I leave. Without any question, that is going to happen.
Bless it.
Moving on. It's plastic. It's just plastic. No big deal. All right. I want to point out to you that the frontal bone's in two parts. Frontal bone doesn't fuse up until a little bit later in development. So when that kid's born, frontal plate can really flex, which is important. But more importantly are these spots here, back here. There's some on the sides. And if you look on page 41, you can see these. What are they? What do you call them? Starts with an F.
Fontanelles.
What are fontanelles? What are fontanelles? Now hang on. This is super duper important. All right? Why does a baby skull have a fontanelle, and what do fontanelles do?
I'm trying to see.
Absolutely. During the birthing process, it helps with them flexing. Fontanelles are called soft spots. You ever heard of this?
Okay.
And buddy, I'm here to tell you, it's the weirdest thing you've ever seen. If you've never paid attention to it, you're gonna be weirded out by it first time you see it. There'll be a little indentation in the top of the baby's head, a little low spot. And every time the kid's heart beats, it'll go. And you're sitting there like, something's wrong with this kid.
Is that where they put the hat on?
Fresh babies are weird.
Do what now?
Is that where they put the hat on?
Well, because their heads get cold because they don't have a lot of hair up there. I was gonna say fur. They don't have fur. So.
That's
we
true.
we hoppers are fascinating humans. The idea is that soft spot up there. Like I remember distinctly, one of my children. I got three. It is what it is at this stage. Like the other one walks up and goes to like touch it, and I was like, "Stop it! Don't do that! Don't push against it. It's okay. Totally normal." That's a fontanelle. And what it does is allows the skull to really flex around it during the birthing process, which we've established is important. Yes.
Yes.
Good. All right, so that's what I want you to know. That's a baby skull, that's a fontanelle, and that's what they look like. Flip the page. Or in my case, go to this slide.
I like when it's specified.
What we have here are the vertebrae. Well, not quite. Question? All right, on the far left here, that's a hyoid bone. Just be able to tell me it's a hyoid bone. It's in your lab manual too. It's just on a different page. So on page 47, you can see the hyoid bone. What is your hyoid bone?
It's a corneal bone.
It is. It's kind of a weird one. Okay. It's a unique bone in that it's the only bone that doesn't articulate directly with any other bone in the skeleton. Every other bone in your skeleton connects to other things. But the hyoid bone does not. It floats in space. What it does is it forms the base of the tongue and the top of your trachea, or larynx, I guess you might say. It's the top of the larynx. It holds the throat open, in essence. So most of this is cartilage, but at the very top it's bone. Okay? And that's good. It's a good thing. It's the hyoid bone. Now, let's talk about your vertebrae. You need to know the following. You have 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, 4 coxal vertebrae. 7 cervical, 12 thoracic, 5 lumbar. That's the real take-home message. 7, 12, and 5. What are cervical vertebrae?
Neck.
They're in the
Neck.
neck. How can you tell a thoracic vertebrae?
It's like the top part of your
They
body.
connect to something other vertebrae do not.
Ribs.
They connect to your ribs. Okay? The thoracic vertebrae connect to the ribs. And last but not least, lumbar vertebrae. These are the big honking vertebrae in the lower back. They're the ones we all love to hate, especially right in this particular moment. My lower back's not happy with me after the thing I did like 3 weeks ago, which is nerve-wracking, to say the least. All right, here's a good old-fashioned vertebrae. On this good old-fashioned vertebrae, I'm going to point out a couple things. All vertebrae will have a spinous process that sticks out. That's why we call it your spine, okay? Spinous processes that stick out. They will have a body, and that body would be articulating with your vertebral discs. What are your vertebral discs made of? What kind of cartilage? Fibrocartilage, good. So your fibrocartilaginous discs would be situated, there we go, on these bodies. For me, you need to learn a few other things, all right? Ouch. If you look at page 43, if you look at page 44, 45, they've got the major vertebrae there. And we're about to talk about it. So this is the atlas on page 43 and the axis on page 44. There you go. All right. Who keeps up with your Greek mythology? Who holds up the world?
Atlas.
Atlas does, which makes Atlas the first. Okay? Looks like Baby Yoda. All right? Totally gives me that, Mandalorian vibe. That shape there is very important. This is the vertebrae that sticks to the base of the skull and allows for a lot of the articulation that the skull sees. This one in conjunction with the next one really gives the skull its main function. Okay? So that is the atlas. You can easily tell it's the atlas because it's like a big circle. Big circle, it's the atlas. The axis and the rest of them look like vertebrae from my perspective. Like they have the more traditional vertebral look to them. That is the axis. And the axis is very easily distinguished because the axis has the dens. But if you look at your picture on page 44, can't really tell what a dens is, now can you? Well, look at it in three-dimensional space. This big thing, hang on, kicking your umbrella.
Oh, my bad.
It's all good, I was trying to tell you so I don't,
I don't want you to hurt yourself.
The dens here would have the atlas sit on top of it, like so. And they are very special together. Okay? The relationship between these two vertebrae is very special. Let me tell you about it. Now, let's make sure we're clear. Axis, no. Atlas, axis. The axis has the dens. Everybody with me? The relationship between these two matters. You see, there's a unique joint found here. There's only 3 of them in your whole body. It's kind of a unique joint. See, these two vertebrae will sit together like this. And there would be a little narrow band of connective tissue holding this all together, right in the front, right there. And what it allows it to do is it allows it to form a structure called a pivot joint. Pivot joint. And a pivot joint is found here and back here, where it allows me to twist my arm like this. So what can your head do?
Pivot.
It can pivot, because of that pivot joint between the axis and the atlas. Yeah,
Okay,
man.
so the atlas and the axis together make a
Allows for
pivot.
most of your skull's movement. That's right. So you can guarantee I'll be putting the atlas and the axis on your test and asking you which one's which, maybe ask about the dens, and ask about the relationship. Then on page 45, they've got a nice cervical, thoracic, and lumbar vertebrae for you. I can guarantee I'll be throwing these on your test and asking you a little bit about them. Cervical vertebrae are easy. They look like a smiley face. Can you see it? It looks like a smiley face. Okay? If it looks like a smiley face, probably a cervical vertebrae. If you want to get technical, they have what are called transverse foramina. Okay? Something no other vertebrae has. Cervical vertebrae have transverse foramina. Those are. Next are thoracic vertebrae. What do thoracic vertebrae do?
Attached to ribs.
They do attach to ribs. And so in order to be capable of attaching to ribs, they have to have structures called costal facets. They must have costal facets. You can see one right there. Costal facets dictate that this is a thoracic vertebrae. That will be an area where a rib attaches. Okay, right there. Area where a rib attaches. It's a smooth spot on the corner. Okay? But, if you want to look at it, well, there we go. If it looks like a giraffe, it looks like a giraffe, it's probably a thoracic vertebrae. Okay? They have costal facets, and you got to know that. But if it looks like a giraffe, yeah, You know what you're doing, okay? And then last but not least, there are lumbar vertebrae. And a lumbar vertebrae looks like a moose, okay? Lumbar vertebrae, they look just like a moose. As moosey as the day is long. That is a lumbar vertebrae and a friggin' huge. So that should tell you something. Big old lumbar vertebrae, moosey. Absolutely. All right, good. And this is the sacrum. None of the sacra we have in this room do justice to this. The sacrum is supposed to have an opening on the back that your nerves travel through. That opening is called the, I can't remember. Oh, sacral canal, yeah, indeed. So it's got this sacral canal that travels through it. Sacrum, because of the opening. All right, cool. Oh, and last but not least here, we've got to do the ribs. Thinking about something. Because what time do we get out of here?
1:30.
What time?
1:30.
You're right. Right. So it's almost 1. Hold that thought. This is too much to do. All right, let's do the ribs, and then we'll move on. Okay, let's do the ribs. So the ribs: 7 true ribs, 8 through 10 considered false ribs, 11 and 12 floating ribs. You'll also hear this done differently. You'll hear 1 through 7 being true ribs, 8 through 12 being false ribs, and the last 2 further called floating ribs. Like, it's variable is what I'm trying to tell you. But the gist of this is as follows. 1 through 7 are true ribs. What that means is the rib goes to the sternum. You see how this is like all 1-to-1? The rib goes to the sternum. False ribs connect to each other, then to the sternum. They are less well supported, our false ribs. And then last but not least, further classified as floating ribs, the last 2, guess what they do? They float. They float. That's fun, I missed it. They float. You can see them in the back here. Okay? Floating ribs. True ribs, false ribs, and floating ribs. Know the numbers. Understand what that means for us. And then let's discuss the manubrium, the body, and the xiphoid process. The top of the sternum is called the manubrium.
Quick question.
Yeah.
So the floating ribs only connect to the vertebrae.
Yeah, absolutely.
Cool.
I mean,
Okay,
there's
just wanna make
got all
sure.
kind of muscle and fibrous connective tissue
Mhm.
surrounding them, but
But
They
they
don't have
only
cartilage.
connect to the vertebrae.
they're not cartilaginous and connecting to the sternum. Correct.
Excellent.
They're very easily broken as well, so it's pretty easy to snap these off. They sort of sit right on the kidneys. All right. Manubrium, body, and xiphoid process. If I were you, that sounds just like good test material. Feels like something I would ask. Hit nudge nudge. And then let's talk about this. Before you walk out of here today, you need to be able to take a rib and show me how it connects to a vertebrae. Take a rib and show me how it connects to a vertebrae. You see all these little things on this side back here? See all that? That's where the vertebrae connects. All right? This thing here is flat and it connects to the sternum. All that madness back there, that's vertebral connections. And the way this would work on the vertebrae, so it sits something like that right there. This one's not quite big enough. Let me see if I can go to a bigger one. Let's try this one. Oh, yeah. Now we're getting somewhere. See what I'm getting at? All right. Being able to show me how a rib connects to a vertebrae, it's kind of important. Okay? So be able to show me, and on your exam, you'll be in good shape. Right? So let me tell you what I'm thinking about. Let's be honest with ourselves here. This material that we're doing, oh man, it is straight out of your lecture. Question?
Sure.
Yeah. Like this. So see all that stuff? Yeah. This stuff we're doing is right straight out of your lecture. So preparing for the lab test, preparing for the lecture test, pretty similar. So let me tell you what I'm thinking about doing. I'm not gonna push through, that'll be too much to do in one day. Just refuse, I refuse. If I look at our calendar, today is the 21st?
First? Yes.
21st? So that means that today, we were in theory supposed to do the appendicular skeleton, which meant that next week we would have a lab exam. Is that correct?
Yes.
I don't see any way that's gonna work.
Perfect.
So this is what I would like to do. Give me a minute. Yeah, this is not gonna impact us at all. What I would like to do is, I'm going to have class on the 28th, that's next week. It says no class on your schedule, we will have class. It's good old fashioned regular class, okay? And we will not have the lab exam that day, we'll finish up the bones that day. That's next week. So next week, we're gonna finish up bones. Everybody with me?
Yes.
We're gonna have a good old fashioned lab quiz, everything's gonna be normal. Regular day, no test. Next week, no test. Yes, ma'am. Can't hear you.
But that's my birthday.
Happy birthday, soon. I just did this for you.
I
I was like, you know what, I bet her birthday's on that day. I don't think she should, I don't think she
It's
should
not
have
really
to
my
take
birthday, I
it.
just want a weekday, but,
Okay, moving on.
yeah.
So that puts us looking at a test on the week of the 7th. Now, we have a lecture test scheduled for the 7th. Y'all, give me a second.
Work it out.
I'm working
here.
on it.
I am here.
There's no way around this. So we're gonna have a lecture exam on the 7th. Then what I would like to do is come back at lab time and do a little bit of lecture for the next test. Okay? This is how it's gonna have to be. You're slated for these time periods. We're gonna use them. I would like to do an hour of lecture so that we don't get behind. The reason you get this look is because muscle tissue, which is lecture 9, 10, and 11, moving through, that's the hardest thing we do a whole semester. I don't wanna have to rush that, okay? So what I would like to do is introduce chapter 9 to you on the 7th after our lecture exam. So we'll take the lecture exam in here on March the 7th, lecture exam in here on March the 7th, and that'll be during regular lecture time. We'll come in during the lab time, and I wanna spend like an hour, hour and 15 covering chapter 9 a little bit, get you started. Then, on the 9th, we'll have the lab exam. So that would be a Thursday? No, Wednesday,
Wednesday.
that'd be a Wednesday. So what we'll do is, instead of having good old fashioned lecture, we'll just come in during lecture time, do the lab test and go home. Deal?
Deal.
That's how it's gonna work. So on the 7th, we'll have a lecture test, on the 9th, we'll have a lab test.
Test. And
And
then,
that'll get us out before spring break, because let me tell you what happens if you do a test right after spring break. Everybody fails it.
mhm.
All right, so that way you can come in, take your test on that week, and then have spring break and not have to think about my class until you get back. Is that a deal?
Yes.
That's what I think I'm gonna do. So what I want you to do right now, I want you to go get a skull, go through all those skull parts. Get some vertebrae. Make sure you know the parts of the vertebrae. See where I'm coming from here? Look at the ribs. Make sure you can see how the rib articulates. You got lots to do in the next 45 minutes. All right, get to it.